Pain is sort of in here, and we also want to work the posterior butt muscles a little bit. The sacrum lies right in here. That's the sacrum, that's the iliac crest, that's the ilium. The gluteus maximus muscle is right in here. The piriformis muscle is right in here. The sacrum is right in here. One thing that feels really good on patients, they don't get enough, is because there's not much muscles on top of there, so we don't learn it a lot in massage school, is work right on the sacrum, on the side of the sacrum. That work can be fairly pointy. That feels pretty good and people relax on it. So I'm going down. I don't want to go into the crease too much. I want to be very careful. That doesn't feel good. Nobody wants to touch our butthole. So that we need to be very careful about. But that's a good move. So right on top of the sacrum on either side of the spine, which is right here. At this point it's called the crest, the sacral crest, median sacral crest. When we then go more into the pelvic area, into the gluteal area, we can start fairly close to the crest or the gluteal fold, but we don't want to push away from it, we want to more push into it so we don't separate them, which again feels not good. But the trigger points are right at the crest, where the bone meets, and so we can sort of do a motion pattern just around here on both sides for the gluteus maximus, and we also get some medius and minimus that way. That's the hip. Right there is the hip. This top of the hip. Right here is a muscle called the tensor fascia lata, which tenses a band that goes down to the knee on the outside, and a band meaning a very flat, skinny tendon. That's a very good place to also work. People get a lot of trigger points in this area and a lot of tension and pain. And then the piriformis, which is right here, sort of the back pocket muscle, is also on that. A lot of people get from sitting, and they get sciatica with that, which is a pain in the back of the leg or the thigh. So we can sort of go right where the back pocket is, and we push in a little bit from the outside again towards the sacrum to the inside. So that, when we look at the upper back, it's sort of the same thing. If somebody comes in and we work the upper back, we can do a more global first approach, going up and down the spine. And then, once we've done that, we feel it, we give it some ease. I'm a little bit fast here, just for showing purposes. We go up the spine on either side, find the trigger points, and then we can go lateral to the side. So the biggest one we have here, when we go lateral to the side, is the trapezius. The trapezius is a muscle that's this big chunk of muscle that often gets tight, especially if your boss has been a pain in the butt and you're all stressed out and nervous. That's a muscle that a lot of people get really tight. So working that muscle is not a bad thing, and it's a good thing. There's other muscles. If we have the scapula right here, going down to this side, a muscle that's right in the corner on the medial side, on the middle side here, in the midline, going up into the spine, is called the levator scapula muscle. And that muscle has a lot of points right at its angle where it comes up. Feel that, Vince?
Yeah.
Yeah. So that's a muscle that, I'm showing it and poking a little bit hard. You see his muscle sort of pulled away a little bit. That means I'm too harsh on it. We've got to slow down if we want to work that therapeutically. Then another muscle that's right when it's on the scapula. This is the spine of the scapula right here. The most poignant ridge that we feel. Right on top of that is what we know as the supraspinous fossa. There's a muscle laying in there. It's called the supraspinatus muscle. That muscle is the most commonly injured muscle when it comes to injuries called the rotator cuff injury or the sits muscle injury. So that's a good muscle to work, especially in the beginning end. Goes all the way out to the side, and then it attaches to the arm on the outside, and when we raise the arm, the first little few degrees of raising comes right out of that muscle. Afterwards we raise the arm with the deltoid, which is up here. So that's an important muscle that we can work a little bit, spend some time on, especially if this is a place of pain and tenderness. That could also be a shoulder injury. The infraspinatus right here is also a muscle, which this is the spine of the scapula. This is the spine of the scapula. And down in this area we have muscles that are the infraspinatus and the teres minor and the teres major. They basically all sort of go from there to there. From the inside, from in here into the humerus, into the arm and the posterior end of things. We can work this muscle group nicely. It's flat, so we want to be a little gentle, but there's very, very distinct trigger points that we can find, and it's usually sore, because those muscles, what they do, the reason why they're called the rotator cuff muscles is because they hold the humerus into the shoulder. So they're always contracting. They're always working, so they're always tight. Because their job is to make sure the arm doesn't fall off. That's a big job. So that's another muscle entity that's really nice to work and find. It's always good to check in with the patient once in a while, not too frequently. Is this working for you? Is this tight enough? You know, let me know if I go deeper. Let me know if I'm too superficial. I want to make sure you get something out of this and this is working for you. And not take a statement that they make personal. Very often it has nothing to do with what we do, it has to do with where they're at.